generally what happens is when you get that foundational stuff supported, then other stuff starts to get better. And so
Hmm.
we don't need to treat every last little thing that's out of balance.
Dr. Aparna Taylor has a love of nature and medicine. She has a Bachelor of Science in Biology, a Master of Science in Muscle Physiology and Aging, and while pursuing her PhD in molecular neuroscience, changed direction to focus on patient-centered medicine and graduated as a naturopathic doctor. Her combined experiences have provided tools that incorporate the principles of Eastern and Western medicine and mindfulness to implement a balanced approach to individualized patient care. Thank you for sharing your expertise with us today to answer the questions submitted by our audience.
Thank you, Melissa. It's a pleasure to be here. And thank you and your organization for creating such a resource for people. It's really nice to see that out there when people are looking for answers.
Yeah, and it's great to be able to answer some of the questions that we get that are not necessarily covered in the literature yet. And we often get a lot of questions about stress, and that's one of the reasons that I wanted to talk to you. And I think we should jump into some questions about stress straight off the
Great.
bat. And
Let's
so the
do it.
first one is, how is stress associated with the onset of illness, and in particular chronic infection?
Yeah, so we have to first understand how we're defining stress. So if we think about it like our brains or our body's perception that there's a threat to our survival, then that kind of changes our focus a little bit because often when we hear the word stress, we're thinking about how we're just stressed out or we're in traffic or there's too many things going on.
Hmm.
And often in this, especially in this population of people who are trying to find answers and it's been around for a long time or it's really intense, it almost feels like we need to stop being stressed out. And so people are stressing about being stressed. So it kind
Hmm.
of defeats the purpose. And so when we go back to that idea of a threat to your survival, you think about the brain and there's two portions of the autonomic nervous system. So that's the people know it as the fight or flight or freeze response, which is the sympathetic, and then the parasympathetic, which is rest and digest. So I'm going to circle back to how it
Hmm.
relates to onset and chronic infection, but really what we need to understand is what that means to the body. So when we're in fight or flight or freeze, if we think about a legitimate threat, like there's a lion and it's going to come and it's going to either maul us or we have to run
Hmm.
away or we have to fight it or we have to just pretend that we're not there and hopefully it goes by, that pressure then comes off. And so the lion either destroys us or we fight it off and then we recover or we pass by whatever that stress is. But now there's these other aspects of what stress looks like in our body, but that flooding of what happens in the body is exactly the same, really,
Hmm.
whether it's a perceived threat or an actual threat. And so when that threat is persistent and then it's additive, then it becomes more of an issue because that parasympathetic, that rest and digest, well, that's where we sleep properly or we digest our food and then we absorb the nutrients or we regulate hormones or all of those other things. But most importantly for chronic infection is our immune system is regulated in that state. So healing has to happen in rest and digest. And so when we add all of these things on, and this is a very real day-to-day issue because this, especially with chronic infections and bladder infections, it's life changing. And
Hmm.
so the whole day is adjusted and your whole life is adjusted to managing how am I going to handle going to this meeting or how am I going to handle if I have to wait in line or what's going to happen if my pain sets in or something happens. And so there's a lot of micromanaging that happens and then there's life on top of that. And so then there's the cues that the body gets. And so
Hmm.
stress isn't just what's perceived, it's actually what's happening. So if you have pain, that's a stress. If you have inflammation, if you have other things going on, and most people don't have just one thing, then it becomes additive. And it's that additive nature that can influence the onset of when things happen and whether or not they resolve. So, why that becomes a bigger issue is that there's the physiological thing that's going on in your body or the thing that's kind of out of balance, but then there's the rest of our lives. And so, if your body is in distress during the day, then you may not have a restful sleep. And if you don't have a restful sleep, then your threshold comes down for managing those other things. And if you think about it as I talk about it like a conveyor belt. So
Hmm.
you've got, like those things at the grocery store with, or I don't know where, depending on where you live.
Yeah.
Maybe they're there, maybe they're not. Maybe we're talking about ski hills. But basically, wherever you are, if it's a conveyor belt that's moving, that's life. Life is just going to continue to move,
Yeah.
but the pace of that conveyor belt will change. What we have on the conveyor belt can change, and how high it's piled up can change. And some of it is out of our control. A lot of it is out of our control. And so that becomes an additional thing. And so why it's associated with the onset may be the intensity of everything else going on in your life that then in addition posed the or put your body in a position where you were more susceptible to something. Or the other aspect is if something is continuing to go on, then maybe there's other aspects that may be influencing the way your nervous system is working and your immune system is functioning and all those other things. So, looking at all of that, it's really about understanding what the root causes are. And so I'm kind of jumping ahead to a few
Yeah.
other areas, but I'm really passionate about this because I find that the foundational things are the things that help healing. And really, that's also going to give hope to people that are thinking, how do I get out of this cycle?
Yeah.
And you just have to figure out what those details are and make it individual for that person. So that's kind of a kind of a broader picture, but I
Hmm.
see it as a really big piece of that foundational health.
There's a couple of questions within what you were just talking about. So, one of them is this ongoing stress. A lot of people say they've had stress in their life before and they've had very stressful situations. So, why would stress suddenly become an issue now? And why could it be linked to a chronic infection like a bladder infection?
Yeah, that's a good question. And often we look back and say, well, why? Why is that happening? So if it was 6 months ago, or if it was 10 years ago, or if it was 30 years ago, there's different reasons. So I think one of the things we can think about is the version of ourselves. So the version of you that was 5 is not the version of you that's 15, is not the version of you that's 35 or however old or 95. And so part of the things that we would think about are what are those other root causes that influence your nervous system, your immune system, and so you can kind of keep the pressure for a while. So I'll use the example of people who stay up late on the weekends and they're able to manage everything. They can jump back in a little groggy on
Mm.
Monday, and then, or whether it's school or whatever it happens to be, or your regular life, and they're able to manage it. But at some point, other things are changing in the background too. So your hormones change as you age.
Hmm.
You collect things. Some of those things are scars from injuries. Some of those other things are conditions. Your blood sugar management changes. The amount of
Hmm.
inflammation in your environment changes. You may have had other injuries. So all those things do tend to add up. You may have had kids. You may not have had kids. So there's lots of things that can influence what your health is looking like. It's not static. It constantly changes. So one way to look at it is and I know exercise is going to come up later, but some people talk about like my tolerance for exercise is not the
Hmm.
same anymore. I used to be able to do X, Y, and Z, and now I
Yeah.
just can't seem to keep the stamina or my strength. And it's because you're a different version of yourself. And so one of the things to think about isn't just why can't I do what I did before? It's what are the other things that are happening that are not allowing me to get better? And so that's really when we think about root causes,
Hmm.
that's part of that question is what about what's happening now is preventing your body from being able to get better? What is it that's stopping the regular process from happening? And then that's what we uncover. And it's a little different than just a diagnosis because a
Hmm.
diagnosis is a checkbox that says, this is this collection of symptoms. This is the evidence that says that this is the diagnosis. But a root cause doesn't have to be a label. A root cause could be an imbalance in your digestive health, or it could be inflammation, or it could be something else. I mean, I'm labeling a number of things and it's vague on purpose because
Yeah.
true key comes from individualized care. So we need to figure that out. It's all in the details. And that's where you figure out, oh, well, maybe this, I used to be able to do this. Why can't I do it now? Well, let's break it down and find out what happened in the meantime. And I think all of that, all of those details, it's sometimes very it can be a little frustrating to kind of break it
Yeah.
down to them. I've told the story so many times
Yeah.
because
Yeah.
by the time I see someone, usually they've seen a number of people beforehand.
Yeah.
And I respect that each person adds value, but sometimes it's not either the right fit or there's a limitation in a number of things. But your journey continues. And if you're not resolving the issues, then we need to ask other questions. And I think that's what it comes down to, is
Yeah.
that if you're thinking about the different versions of yourself, what questions can we ask that are telling us why it's different now?
Yeah, it's a good way to frame it. And you're right that a lot of people in this community have been to see many providers. And our main message is always that you need to find the approach that works for you. And sometimes that can mean talking to more people to find something that really resonates. But one of the questions about stress is why it can trigger symptoms. So people might feel stressful and immediately have bladder symptoms. And they
Mhm.
ask whether that is because the infection suddenly flares up, or is it inflammation or another mechanism that makes you feel like you have symptoms because you're stressed?
Yeah, so those are good questions too, and it depends on what it is. For some people, it can even be a perceived threat, and like in
Mm-hmm.
that moment where all of a sudden they realize they've, lost their keys or something, and then all of a sudden something twinges, and they're like, "Oh no, right now!" So like I'm late for work or whatever it is. So what happens is that if you think back to when we were hunting and gathering, and we were getting the cues from our body of a threat to your survival, I still come back to that simplistic way of looking at it, and the reason is your body is preparing to do different things in that moment. And so it can't, that's one way to look at it. I mean, other than actually individualizing it and assessing each person to figure out why it happens for them, very generally, for someone who's trying to think, what else can I do to help myself? That could be one other thing that they're kind of finding out or being aware of is
Mm-hmm.
what is it in that moment that's done it? Was it just that one thing too many? Or was it all those micro stresses that added up that was raising the heart rate a little bit and making your mouth dry and you're sweating a little and all these other things you're getting ready to fight or run away and
Mm-hmm.
then all of a sudden it just twinges and then something happens. It's just one thing too many. And that on its own, the threshold is already lower for people of their tolerance for things because
Mm-hmm.
they're in pain, they're in discomfort, there's an imbalance, and there's a chronic infection. So
Yeah.
that's going to have a number of other effects. So if the question is, does it turn on the bacteria? I don't know that
Yeah.
there's any evidence that
Mm-hmm.
that environment will then make a bacteria wake up. I don't know that I can't say that for sure because I haven't looked it up. But
Yeah.
I think just knowing the behavior of pathogens or bad bacteria or whatever the organism happens to be, the internal environment will change. And so
Mm-hmm.
we're not isolated. And this is something that's so important. I'm really, really passionate about. So we don't compartmentalize. So I don't compartmentalize somebody to their bladder. Their genitourinary system is one system that is showing the major issue as the loudest fire, or the biggest, sorry, not I guess
Mm-hmm.
fire isn't loud. Well, it could be, but it's the biggest fire or the
Yeah.
loudest, horn that's or siren that's going off. But there's a number of other things. You're a closed system, you're connected to everything. And so I think part of that is understanding what the process is for that individual person and where their threshold is, because maybe their threshold is lower because they
Mm-hmm.
have this much pain or they have this many other things going on that are influencing their ability to get better.
Mm-hmm.
And so that's why maybe for some people, and it could even be hormones too, because if their cortisol tends to blip, I mean, for instance, your phone, every time you get a message, your cortisol
Mm-hmm.
goes up a little bit. And sometimes it's a good feeling and sometimes it isn't. But anything can influence your body in a way you're not really necessarily thinking about. So it's individualizing it, making sure we know for that
Yeah.
person. But that's why in some cases it feels like, oh, this, I can't handle this. I'm overwhelmed. And your body is legitimately telling you, yeah, you're overwhelmed. You need to there's too many things going on, and some of it
Yeah.
is that foundation that of that discomfort that's bringing that threshold down for things you can manage. So it seems like we can handle less stress or less change because change is stress too.
Mm-hmm.
And it feels like it has to be this really narrow, I call it like the African violet blooming syndrome, where
Yeah.
you have like the right humidity and the right sunlight, and then
Yeah.
it blooms and it's beautiful, but it's not really in this state because we have such a narrow window of function.
Mm-hmm.
And if it goes beyond that, then we can't. And stress is part of that. And it's because your brain is thinking, okay, what do I prioritize now? And sometimes it's even noise. So I believe that to be the case for most people. It
Mm-hmm.
seems to really encourage healing when we figure out for each person which is the thing that brings calm. What is the
Mm-hmm.
thing that, because sometimes just pushing away stress doesn't work, because then you're just constantly thinking about how to beat off whatever's coming at you. It's
Yeah.
about nourishing and finding out what's going to fill my cup, what's going to make my nervous system feel calm. And it's not something that you have to do to yourself. It's sometimes just understanding what is the cue. Is it I bring it back to pain and inflammation because those are the two really big
Mm-hmm.
ones that prevent people from moving forward. Um, not to ignore the part about the infection itself, but it's such a bigger piece. So we can't really do anything for the infection if the inflammation is, rampant. So I guess that's why I'm bringing it up more.
Yeah.
But I think that may be one of the keys, but it does matter for each person. And so I would break it down and find out for each individual what it is, if that answers the question.
Yeah, I think so. But it also brings up another question about whether managing or reducing stress can be enough to help heal an underlying infection, or is that just one part of the process?
So I guess it depends on the individual first. And secondly, the population of people I treat is kind of skewed a little bit to a
Hmm.
more, I talk about it like, you have the bell curves. And so I'm doing mostly these, the outliers, because
Yeah.
generally people are really intelligent. They have resources such as your resource online, and a number of other, people are able to access literature more, and just
Hmm.
talk to other people. So it's not so simple, because that's the majority of people that can find some answers. It's why, what are the details of why it's not getting better? And
Yeah.
so I think breaking it down to that would really help.
Hmm.
And can you please repeat your question again to make sure I've answered it? It cut
So
out.
whether removing stress from your life, if that was possible, would be enough to resolve the infection, or is it really just preventing symptoms from happening?
So I think it depends on what the stress is. So we're
Hmm.
talking about it in one way where the stress is coming from external sources or the brain being overwhelmed. But one of the stresses is a chronic infection itself.
Hmm.
So
Yeah.
chronic infection is a stress. So that's one of the root causes. So we do need to address that. And if
Okay.
we don't address that, then it's going to continue in a way.
Yeah.
So I think looking at it as, the way that I tend to look at things too, and the way I was taught is um, obviously what the priority is for each individual, the root causes and diagnoses. I think all of those things are important, but
Yeah.
then also what are the risks and the benefits? And this is different for each person. And I think I emphasize this because sometimes we review a number of things on the internet or literature, wherever we're finding it. And then we review it and we think, okay, we've heard this enough times. This must be something I need to do. But
Hmm.
then we don't know if the devil's in the details. And so it could be that even something as simple as vitamin C can be disruptive for some people,
Yeah.
even though it's good for your immune system, but it can trigger symptoms, whereas for someone else, it might not. I
Hmm.
can't really give specifics on interventions without knowing, because natural doesn't always mean safe.
Right.
But it's a thought to understand, okay, is it really the vitamin C, or is it the excipient or something in the product itself,
Yeah.
or how much you're taking? And so all those details do matter. So when you take down the level of stress that you have in whatever way you can bring nourishment for the reason that that distress is there, it certainly will help, because it's lowering. Remember, we were talking about all those micro things that add up. It
Hmm.
lowers that cue to the brain to then be vigilant. And so what it then does is take down the fight or flight or freeze or some sympathetic dominance into more rest and digest. And even moments of that in the day can make a difference, because then your body is getting that cue of, oh, I'm like a rabbit frolicking in the meadow. I can
Yeah.
just relax and there's no threat to my survival. But it is challenging, particularly with chronic infections and this particular one, because the symptoms
Hmm.
are like a low grade siren, like
Yeah.
just constant. And then you add on another siren and then another siren. And so there's a number of those other things. So generally, yes, if you can support your body and bring in more nourishment to bring calm for whatever the cause is of that distress or stress that your body is perceiving or that is there, then it will be able to go into that healing mode, and then you'll sleep better and all those other things will happen. So I do think it is all connected, but
Hmm.
it's not necessarily linear, because we're not ever doing one thing.
Right. Do you think that stress has an impact on the efficacy of antibiotics or other UTI treatments?
So I haven't done a study myself
Hmm.
looking at that. And again, I'm not ever doing one thing, and I haven't looked up any studies
Yeah.
that have evaluated that, particularly in this population. So from that perspective, it's not an evidence-based answer. But what I would say is that, like any intervention, the benefit of the intervention is going to come from the totality of all of the root causes and whether we're addressing them or not. It doesn't have to be a really aggressive program. It just means if you have an imbalance, and one of those imbalances is that your immune system isn't functioning right, you
Mhm.
can't kill every last bacterium with antibiotics. Antibiotics are going to bring the volume of the bacteria down low enough so that your immune system can take over. So we need that partnership. And so a
Hmm.
lot of times people are on this a different conveyor belt where it feels like they're just on and off antibiotics or
Yeah.
antibiotics, depending on where you're from in the world. You say it differently, but it's just it seems like it's just constant, and then they feel better when they're on them, and then they go off, and then it the same. And so it's
Yeah.
why is that happening? And part of it doesn't mean it's because of the immune system, but it's one of the questions. And
Right.
so if we can optimize the functioning of that, and it's really what's the risk of bringing more calm into your life? Not a lot, usually.
Right.
So I've yet to meet somebody who says, I'm too relaxed, I'm too chilled out. Again, I have a skewed population, not to make light of any of these things, but I
Yeah.
think bringing that joy and bringing some of those bits of things into your life that shows you that there's hope beyond what the experience is now is also really important because you got to zoom for the target. And I think that's back to beating away the stress versus trying to bring in things that are going to add
Hmm.
nourishment.
In terms of trying to manage the stress or reduce it in your life, how important do you think exercise is?
I'm biased. I love movement.
Yeah.
And I think the evidence does support that there is benefit to exercise, but
Hmm.
the word can mean different things to different people. And
Right.
so sometimes I will just call it movement therapy.
Hmm.
And partly it's because people who we talked about earlier, when people could handle a lot more earlier in their lives, and now it seems like they can't. Some of it is the amount of exercise that they do. And with this type of a condition, if you tell somebody with a chronic UTI that they're going to have to be on a rebounder and on a trampoline for six
Right.
hours, it's like that on its own is going to not be very
Yeah.
comfortable to even think about. And so exercise can mean something different. And so I think what we do need is some form of movement. Our bodies need to move. The immune system, the lymphatic system doesn't have a pump. And so we think about people talking about lymph nodes. Often they're checking their lymph nodes here. That's part of your immune system. They're all over the body, and the congestion of that. Now, I'm diving a little bit towards my passion of naturopathic
Hmm.
medicine and the basics, but really we want things to flow and we want them
Right.
to be optimized. And movement is the best way to do that. So for some people, it means they go for walks. For some of my patients, they can walk between or individuals in my practice, they can walk between one lamppost to another and back. And that's as
Yeah.
far as they can go. And other people, they want to do CrossFit again, or they want to do something else. And so
Hmm.
it's really a wide range. So how I would look at it is, and what I do tell people is, um, do continue to try and move
Yeah.
what brings you joy. But then if you can't tolerate it or it feels like it's too much, then you just pull back. But I think it's amazing for your mood. It's great for your health. It's great for just getting outside and the body feels it's just I'm very passionate about it. So before I start diving into all the other things, I'll probably end that and end it there. But I do think it's really important for people to connect to what they like because
Hmm.
it's for a lifestyle of that foundational stuff.
Yeah.
And that includes just whatever you do in your day to day.
Are there other things like mindfulness or breathing activities that you recommend to people?
Yeah, so I think again, it will depend on each individual. For some people, they actually become more distressed thinking about their breath, even though
Yeah,
that's the
fair.
first thing that we usually tell people is breathe. And so there's something called box breathing, where
Hmm.
you can, I'll show the picture in the back where you inhale, then you hold the breath, exhale, and then hold the breath. And so that kind of prevents this type of breathing. But when you're in that moment of distress, sometimes that doesn't help.
Hmm.
So what I do tell people is, to find something that you connect with, where you can do it for maybe 2 minutes a day. And it could be thinking about your breath. It could be counting your breath.
Hmm.
Inhale one, exhale one up to 10, and then repeat. Sometimes people don't want to do that, and that's okay. It could be listening to music. I'm really passionate about bringing music into your life in whatever
Hmm.
form you enjoy. Maybe not like a super heavy metal kind of song that makes you want to bang, like dance around and stuff. Like it should be something to bring you into parasympathetic.
Hmm.
Um, Unless that does. For some people, maybe it does,
It's
but
definitely possible.
so what we want is something that you connect with, and as many senses as you feel you want to involve, that involves more cranial nerves. And so, for instance, when you walk into a place where you're going for a spa treatment or massage, generally the music is calming and it's light, it's not too loud. There may be candles burning, there may be some aromatherapy, and all of those things are powerful to create an
Mhm.
environment with calm. And so there's a reason for that. And scent, especially aromatherapy, is also something that you can utilize because that is the only cranial nerve that goes directly into your brain. There's no
Mhm.
relay system. And so it's so powerful, which is why we can connect to something right away and it brings back a memory or
Mhm.
you not feel good either.
Yeah.
But you can use all of those tools. And so I think one other thing that you can do, there's so many tools out there, but it has to resonate with each person, and they do work. But the thing is, they work for the moment while you're treating the root causes. So don't feel like, oh, this isn't working. Then you can try something else. You don't have to be married to one thing. If it doesn't work, try something else. Try it again. Try a combination. But another thing I have people do. That I've learned, and all these I've learned from other people, is you take stickers and you can be creative if you like, and then you can put them in different areas of your environment. So not
Mhm.
on the computer screen if you look at it a lot, so not something where you're going to tune it out. Maybe the inside of the visor of your car if you're in a
Mhm.
sunny place, inside of your drawer where you might pull it out a few times a day. Maybe where you're going to get your glass of water because you're going to hydrate well, any of those things. And then when you see that sticker, use that as a reminder to do one of the tools, whether it's a
Mhm.
breath or just repeat an affirmation or a statement that you feel is healthy for you or something that brings you joy, or it could be to just have a memory or just close your eyes for, 5 seconds or whatever it is. Because what that does is it brings you down into that parasympathetic, I shouldn't say down, but it brings you into
Mhm.
parasympathetic. Um, and then that's throughout the day, that can be really powerful. And I've had uh, a meditation teacher who talked about, you know, if you can't sit for 40 minutes to meditate, sit for 40 seconds or
Yeah.
15 seconds or whatever it is, because it's throughout the day when you're getting those messages that will remind the brain, no, I'm not under threat. The other thing you can do if none of those things help is you can start labeling things in your environment. I see a glass of
Mhm.
water, I see a mirror, I see a window, I see, the dirt that I have to clean up or whatever it happens to be. I'm not going to
Yeah.
label everything in my room, but it's all of those things because what it's doing is it's changing the track that your brain is on.
Mhm.
Helps you get away from pain too. So these are tools that the stress doesn't have to be, anything that's coming at you. It could genuinely be something that's happening in your body in that moment that you're
Yeah.
trying to nourish. But with the hopes that we're also treating that too, so that it does resolve.
It is important to put it in that context because the chronic illness itself brings a lot of stress, and it's important to think about implementing any of these things incrementally. And we often get those kinds of questions like, how could I put all these substitutes in my diet, or how could I possibly suddenly exercise again, or suddenly practice mindfulness? And so just talking
Mhm.
about it in really small amounts of time is helpful, I
Yeah.
think, for a lot of people. But that does bring us to the diet questions that we received. And to
Yeah.
what extent do you think that gut health has an impact on chronic illness?
So again, I'm very biased. And one of the things that I will say, and we do know, is that most of the immune system is initiated in the gut.
Hmm.
So if your gut health isn't optimized, or if it's not, if you're noticing that there's symptoms and it's distracting you, there's probably something we could do to adjust it. But
Hmm.
it's not, and my patient population is skewed. The way that I practice isn't with like a recipe that I do the same thing with each person because it
Yeah.
really, it could work maybe 50 or 60% of the time, but we want to go for the target, so it's individualizing it for each person, and diet changes can be so incredibly, jumping back to the first topic, incredibly stressful for people because they're
Yeah.
already feeling like they're limited on resources, they're tired, they're trying to get through their day, and then the like overwhelming mountain of how do I change what I'm eating and what do I
Yeah.
eat becomes so it defeats the purpose. So that's why using the word calm, it should bring you calm and nourishment
Hmm.
is what's going to take away that cue of anxiety and distress because then we're putting you into fight or flight or freeze by giving you a treatment plan you can't follow, and then you're not
Yeah.
going to be in risk and digest. It doesn't work. So I do think it plays a part, but I have a harm reduction approach,
Hmm.
which is where are you now? What are your priorities now? And then we do that risk benefit analysis. So if somebody says, well, I want to smoke 6 packs of cigarettes a day still, and I want to have, like a bag of whatever for processed food for breakfast, lunch, and dinner, then there's a consequence, but it's a risk benefit. So what's the risk? What's the benefit? So we
Hmm.
talk about it in that language, and partly it's because some of these habits that we think we need to change, they're not there because we're trying to harm ourselves.
Right.
So I think that's the other piece that it feels like then we go through this guilt cycle of I shouldn't be doing this, but it's the only thing that I can do, and it makes me feel nourished in the moment. And
Yeah.
so then that adds to the distress. So let's throw all of that away and just focus on what can I do to nourish myself? What are the things what can I do today?
Yeah.
It might be today, I can, for SMART goals, you can make SMART goals. So they're simple, measurable, attainable, realistic within a time frame. So today or this week, I'm going to make sure I have one meal that is X, Y, and Z. And this is a really big topic because it seems like when you look something up, somebody is telling us this is the right diet, and somebody
Yeah.
else is saying this is the right diet, and you can't eat this, and you can't eat that. And so then how do you mix the gut health with the UTI health, and which diet do you follow?
Yeah.
So it can become very overwhelming. So my aim is to take all of that mystery out and just focus on the things that are going to be nourishing to that person. And there are legitimate things that don't help. And again, back to the risk and benefit. If you're eating a lot of processed foods, sugars, they feed bacteria, they feed bugs. So you're going to get a lot of that. You're going to get a lot
Hmm.
of inflammation. You're going to have, some other insulin imbalances and other stuff going on, and then you're going to go through that cycle, and then you're going to have cravings, and that's the typical. Does it mean it's everyone? Well, again, in my population, that's what I see. I see that
Yeah.
when they're eating processed foods and less nourishing foods, it doesn't last very long. The benefits. So if they're saying, well, I can do this and it gets better, but then it comes back. Well, maybe
Yeah.
that's one of the things, but that's where the root cause comes in. Is it because of that, or is it because of something else? So I don't have an attachment to it because I know how hard people work to try
Yeah.
and get themselves better. I know how much they want this to go away, but they also want to go back to their lives, which is why it's taking all of that extra emotional stuff out of it helps, and just focus on the target. Like, aim for the thing that you can do, and then
Hmm.
be nourished about that, and then think about it as a risk benefit, because then it doesn't feel so heavy.
Yeah, it can be very overwhelming trying to do the research yourself and make those types of decisions. But when it
Yeah.
comes to figuring out whether gut health is part of the problem, are there tests that
Mhm.
you utilize to assist with that, or is it mostly based on symptoms?
So I do one test if people haven't had it done, but
Hmm.
generally it's a overall assessment. This test you can do anywhere with any doctor usually, and that's to rule out whether or not you're celiac or allergic to gluten. And
Hmm.
so that's one that when people come with a chronic issue and it just seems like, especially with the bladder, it feels like something's not right. Then I ask them, what is your relationship with food? And then we kind of go from there. And if they still have it in their lives, one thing that's really, really, really important to know is that if you've eaten gluten your whole life and you've been fine with it and you decide to go on a gluten-free diet, if you reintroduce it, but you are allergic to gluten, you will have really distressing symptoms, or you can.
Hmm.
And so the risk of that is really high. So to me, I don't just throw people on a diet right away. I ask them
Yeah.
about their history. I ask them, have you ever explored? And most people have explored diet changes by the time I see them.
Yeah.
However, I have had people who, unfortunately, in their well-meaning journey, whether it was from somebody else's advice or their own research, have attempted certain things. And these are people in their, 40s, 50s, 60s who have lived their whole life eating gluten,
Hmm.
but were gluten sensitive to the point where they had allergy and very distressing symptoms. But that's a key issue, because not only is it going to change your absorption, but it's going to change your just your inflammation. You could end up having nutrient deficiencies. Iron is a big one. So
Hmm.
that is one test that I recommend people, if you haven't had it done and you're kind of thinking maybe I should check that out. It's something to explore. It's not something I
Right.
do with every single person, but it's a question that I ask. As for the other tests, this is a big industry
Yeah.
because there are some. If you're checking in different parts of the world, you can have different tests for pathogens. It could be, gut health for different organisms like H. pylori or something else.
Hmm.
But really, there's a lot of private labs out there. And so I tend to look at all aspects of the risks and benefits. And a lot of those tests are quite expensive. And so it's
Yeah.
not just, people say, don't be my accountant, but it's not just that. It's how is it going to be utilized? What is how might it change the direction of treatment? And so if it's something that is generally going as planned, then the history is really important and we
Hmm.
can continue on the path in that way. If the question is not really being answered, or it really does seem like for that individual, there's a lot of just something that doesn't seem to make sense, or there does seem to be something going on in the gut, then we might address it sooner. But if things aren't going well, then we start going down the rabbit hole and then we go into more testing if we need to. There's not one test that I will
Hmm.
use. There's not one lab that I think is like above everybody else. I think
Yeah.
they're all pretty generally good,
Hmm.
and will answer the question you're trying to answer, but I don't think there's one that does all of it. And it's also dependent on the practitioner and the person and what they're looking for.
Yeah,
So
for sure.
I tried to keep things as simple as possible at first, partly because then it's simplified for me too. Right?
Yeah.
Then it's not so confusing, but also the wider you throw the net, sometimes you need to, but the wider you throw the net, sometimes we can get lost in the details. And this isn't by any means to disrespect anyone who's doing it that way. I think it's also very valuable to say, well, if we don't throw the net out wide, how do we
Hmm.
know what we're missing? So I
Right.
think there's utility to both, but ultimately, at least with the people that I tend to see, it's been so many tests and so much that they've done already and so much
Yeah.
investment. And so we're really looking at, if we break it down to the simple stuff and the foundational things, what makes the most sense now? And generally, that does, when the body is super smart, it's going to tell you where things are out of balance. And so if we listen to that and people are really self-aware because they've worked really, really hard to give you all the information and they've done
Hmm.
all the research, but it's just like it's so frustrating because it's not working. So I
Yeah.
really I feel for all of the people that have been on this journey at some point or on it now because it is heavy. And so all of these other things sometimes can add to that, but not really benefit. So I think
Right.
starting with some of the basics, at least for the people that I tend to see, because generally what happens is when you get that foundational stuff supported, then other stuff starts to get better. And so
Hmm.
we don't need to treat every last little thing that's out of balance. We need to address
Right.
it to know it's there, but maybe we can find one treatment that's going to cover two or three things. And then
Hmm.
we kind of assess after the number of minutes, or not minutes, number of weeks or whatever it
Yeah.
happens to be. If it was minutes, then it wouldn't be this hard.
Yeah,
But
exactly.
wouldn't
But
that
that
be
does
nice?
kind of lead me to my next question. It can be really difficult to stick to these kinds of changes. So how long will you have to wait to see a positive impact of making dietary changes?
Good question. It does depend on what the starting point is.
Hmm.
So if the individual, I mean, it's a kind of hard question to answer because it
Yeah.
depends on what we're looking for. So if the gut health is not optimized because there's a sensitivity, let's say, and
Hmm.
sensitivity is different than allergy. And that can encompass a whole other conversation that maybe we'll do another time. But if the sensitivity is there and you know that it's there, that's one aspect of how long does it take, and I'm going to come back to that before
Hmm.
we can tell if it's good or bad or anything.
Yeah.
And then there's how it relates to the bladder. And so
Yes.
if we're thinking about taking something out because it relates to bladder, it may be immediate. It may be within 2 days. But if
Hmm.
we're thinking about something that might be sensitive to you, the body, and it's a food, let's say, in the gut, then if you think about what's happening and why people get that sensitivity, the tissues are inflamed. And so we
Yeah.
have this tube from here all the way out, and it's supposed to be, independent. But then the tissues, the mucous membranes, if you have inflammation, what happens is those intestinal cells, they start to kind of swell and break apart a little bit. They're called it doesn't matter, cap junctions, but stuff starts leaking out. So basically you eat something and then it breaks down into the smaller bits, and then the smaller bits start to get into your bloodstream, and then your body
Hmm.
says, whoops, that's not supposed to be there. And then it makes an antibody. And so then that antibody it's this protein, right? So it's really small. And so sometimes what needs to happen is you need to remove it completely
Hmm.
long enough for those antibodies to come down, and then you have to reintroduce it. And so
Okay.
when you reintroduce it to find out what happened, which is why it's so important that if you're not sure if you're gluten allergic that you
Yeah.
need to definitely test before you do that. So when that happens, then when you put it back, and there's a particular way that's more optimal to really answer the question. And the symptoms can be anything from mood changes to
Mm,
rashes to joint pain to bladder getting aggravated. It could be anything. But if it's in according to the body, if it's this is foreign, I don't like this, I'm going to attack it or I'm going to bind to it or whatever, you're going to have a symptom, and then that will take weeks.
yeah.
So you have to remove it for you, and it depends. Some things you need to remove 3 to 4 weeks, sometimes a little longer, but roughly you want to stick to it long enough to know. So if that's what you're trying to answer, then are you removing one food or more than one? And
That's what
so
I was thinking too. Do you need to move them all at the same time, I suppose, because you need the inflammation to come down?
again, it will depend because sometimes when I talk to people and they talk about what they're eating and they say, "Do I remove dairy, gluten, sugar, soy, eggs, like all of those things?"
Yeah.
So again, it depends on the question you're trying to answer.
Hmm.
So a lot of times people will say, "Well, I don't know. Like sometimes I feel like I'll eat this and it's fine, and then next week I'll eat the same thing and it's not fine." And so then we talk about it's like the barrel effect. So if you have a barrel and you have something coming in that whatever that happens to be, that is, and by the way, I don't know if there's any evidence to prove this, but it's
Right.
the way that I was taught, and also the things that seem to make sense. You have something and it's additive, kind of like the stress. So if you think about it
Hmm.
like that, and their barrel is yay big and it's got some things in it, but it's mostly empty, you can have something and maybe you're not going to have symptoms. But let's say you've had a weekend away or a week away and you're eating different things, and you don't have the same amount of control or whatever it happens to be, and then it starts getting filled up, and then you're eating one thing, or maybe not even that, but you're eating one thing but the barrel seems to be more full,
Yeah.
and maybe it's not just foods, maybe it's other things going on in your environment or your life,
Hmm.
then that one thing could be one thing too many, and then you get symptoms. And so it really depends, and that's why the details matter so much, because it can be so frustrating because people are so committed and they're working really, and it's
Yeah.
so hard to change your diet.
It really
It's
is.
but then it can be really valuable too. So it's also a mindset thing. But when you're already feeling deficient and then you're in further distress because you're restricting even more, that's why I don't recommend it for everyone right away, unless it's something like what I was saying earlier, where they're like eating a bag of sugar every morning and then all that other stuff that might not be good for the body. But again,
Hmm.
risk benefit analysis. So I think um, for some people, depending on what their body is experiencing,
Hmm.
they may just be inflamed by almost everything. So then we
Yeah.
have a discussion and they're saying, I feel like sometimes I'm drinking water and I get bloated. Like, what is going on?
Yeah.
And so then we do break it down. We break it down to which are the things that are the things that you can do right now, and what is the question that we're trying to answer, and when do we know we've answered it? Because otherwise, following a diet indefinitely is also not functional unless it's a lifestyle, and unless you're, for instance,
Yeah.
if you're allergic to gluten, don't eat it. Or when you eat it, you know you're going to get certain symptoms, and if
Yeah.
it's a risk benefit again. But generally, if you're sort of sensitive to something and then you're just restricting yourself, you're already feeling restricted because you can't be social the way other people are social. So then what do you do?
Yeah.
And then you can't go out for dinner or lunch. It becomes more in that fight or flight or freeze rather than rest and digest. And it's
Yeah.
not healing. So I hope it's not frustrating for your viewers to hear, like, it depends. But it really
Yeah.
does. It really has to be individualized, and it should be kind of identified as a short and long-term plan for people, because um, first you need to know that it's working, and then we need
Hmm.
to know what to do about it long term, because it doesn't make sense to just eat 5 things unless you're allergic to them.
Yeah.
The other things, that is.
Yeah.
So
Yeah, got it.
yeah, does that
Yeah, I
answer the
think,
question?
yeah, it does. And I think it aligns a lot with what we say and what I said earlier, that you have to find an approach that works for you. And in my personal experience, dietary changes have been really significantly helpful. And
Mm-hmm.
that helped me to overcome my first experience with chronic UTI. And then more recently, I had endometriosis surgery, and the surgery
Mm-hmm.
somehow started off some kind of mechanism where I became sensitive to a lot of food. So I'm
Yeah,
also everything that you mentioned with trying to implement multiple things at once, not feeling like you
yeah.
can eat anything. I've been through all of that too. So I can really
Oh.
sympathize when people reach out with these same
Mhm.
feelings. And
Yeah.
it can be difficult, but I like the way that you framed it as a lifestyle, because if you can
Mhm.
figure out a way that it is somehow part of your identity, something that you
Yeah.
know that you need to do, that you embrace as a positive action, it
Mhm.
can be helpful, but it is incredibly difficult at the same time.
It is. And access is also part of an issue. For some people, they may live in a remote place,
Yeah.
and the grocery store has not the things that they're hoping to get. And so then there's a financial constraint of trying to order
Yeah.
things, and you can order anything online now, but it's really, then you might not be able to afford it. And so it has to be sustainable too, whatever that change is.
Yeah.
And it has to feel, like you said, it has to feel like it's something you can embrace and feel good about. And if there's even a tiny cue of something that's like a little thorn that says, I don't want to do this, then we need to find an alternative. We need to figure
Hmm.
out that's one of those root causes. We need to figure out what can we do to make this smoother and a wellness plan, because otherwise it's not successful. And ultimately
Yeah.
the compliance will be low. So,
Yeah.
if taking something doesn't feel good, then we need to find out why.
Yeah, I agree. Sustainability of any approach is key.
Yeah.
So you have to find something that works for each person.
Hmm. And that continually changes too. And I think that's the part that just understanding that we are constantly growing and changing, and the
Hmm.
environment also has an influence. Other people have an influence, all these other things, because it's like, if we're physically active, we're going to be physically fit. And then we can't just kind of reach a level and then say, okay, I've reached it now. I'm just going to sit down
Yeah.
and not do
Yeah.
anything else. It doesn't work.
Yeah, it's true.
So so it's also about knowing that there's going to be times in your life where things are going to wax and wane, and just to be gentle and understanding of yourself, just as we would with other people, to say at this time, this is what I need. And just if you can take some of those extra things off of your to-do list.
Hmm.
Um, and there's a positive psychology researcher named Sean Aker,
Hmm.
in the US, and he's got some really neat stuff out there. And part of it is just he's one of the things, he collates data from other people too. So I don't know who to give credit, but that's where I read it. And he writes, you can start your to-do list and start by crossing things off, like add things you already did, because then you're already
Yeah.
ahead of the game.
Yeah.
It's like brush teeth. Okay, I did
Yeah.
that. But it's the idea is there to encourage your brain to see the target and to feel
Hmm.
encouraged and inspired to reach it. And I think it's true for most things.
Yeah, and like you said, most people in this community have tried so many things. Sometimes it can be helpful to think about that. That's progress. Even if things didn't work, you know that it didn't work. Now you have to move on to
Yeah,
the next thing. But it can be very
yeah,
difficult to continue, and it's exhausting, and you get
it
decision
is.
fatigue. And so it's
Yes.
also important to know that you're not alone in that. And there are support groups where you can chat to other people in similar experiences, or reach out to our team as well. And
Yes.
sometimes it can just help to know that you're not the only one going through that experience.
Absolutely. And it's just this feeling of how do I get through this moment?
Hmm.
And really that I think somewhere along the way we had maybe I read about the anxiety about the condition itself.
Hmm.
And how do you put that together with the program? And really it is just breaking it down to the smaller bits of the things that you can do, and to understand that it's not that this is the way that it's going to be. There's an acceptance that happens of this is where it is right now,
Hmm.
but also understanding that because people are advocating for themselves and they're looking for answers, there are things out there, but to do it in a way that's with the intent that there is going to be something if we find the right combination of things. And
Yeah.
and it's also when things don't work, those details are also super valuable, because if
Yeah.
something tried something and it didn't work, it doesn't mean that thing itself isn't that intervention isn't working. It's maybe it was the brand, maybe it was the dose, maybe it was something else in it, maybe it was the time that it was taken, maybe it was interacting with something. So
Hmm.
it it can be exhausting, but it doesn't have to be if you have this community, if you have your community, or if you have other people that you can talk to that will say, well, let's do this together, and then we can kind of find an answer together, even if we don't find it right now. There was another example that I was thinking about, where our mindset, and this is again not at all to make anyone feel like anything about they're making it happen on their own. It's a
Hmm.
natural response to an unnatural situation or an abnormal
Hmm.
situation, that the responses are very expected. But when our mindset is, it's so hard to do this, then the hill is even steeper. It looks
Hmm.
steeper than it actually is. And so they've even done studies where they've looked at people who have different mindsets and how tired they are. And so it's a natural feeling. So when people feel like, I just feel like I can't do one more thing. And you mentioned treatment fatigue and decision fatigue, and it's
Yeah,
a thing because
definitely.
it's vigilance. And so
Hmm.
back to that idea of the micro stresses and the conveyor belt, anything that is bringing our attention to pay attention, which is why with constant chronic bladder symptoms, when they're constantly there in the background, it's a vigilance factor for the brain. I can't sleep. I have to pay attention. Something is wrong. And so that cue and that vigilance is also something to bring that, if we can nourish that somehow and eliminate some of those things,
Yeah.
then that can help too.
Yeah, it's definitely an approach a lot of people in our community are interested in. What types of patients do you generally see?
Humans. Usually,
Good
I don't.
start. Yeah.
I do get some questions about pets, but no, I'm
I'm not
just kidding.
surprised.
But no, I don't know how to treat them. But so majority of my practice is adults,
Hmm.
but I do have a variety. As I said, it's kind of like this is the bell curve, and I think one of the things that I think is important is that whoever you're seeing, you should feel like you're connected and resonating and on the same page, and that the approach is going to be similar. So it's a partnership. So I see people of all ages, and humans.
Yeah.
So.
Narrows it down. And how can people get in touch with you if they'd like to make an appointment?
So I do have an online booking system through
Hmm.
my website, but I recognize a lot of people are maybe not in Canada and I'm in Alberta. That's kind of one of the pictures. If
Yeah.
people can't make it
Yeah.
out to the mountains, that's what kind of what it looks like. So I'm licensed in a few provinces in Alberta, sorry, in Canada. But if you have a practitioner, so I've had people where they will sit with their primary care or they'll sit with their practitioner and then we do the appointment together.
Okay.
Then the regulatory colleges seem to be okay with that.
Is that just within Canada or international patients as well?
International too. So if you're wherever jurisdiction, because there's some regulations when you're when you're a regulated profession,
Hmm.
you can only practice where someone can protect you. Oh, sorry,
Yeah.
someone can protect the public. And just regulate what you're doing. And so I do follow that. And so if you're somewhere else, as long as you have a primary care with you and you're
Okay.
kind of on board together and it would be helpful, the aim is to be useful. So if there's something that they find useful, I'd be happy to help. And generally, then we just kind of come up with a plan and how to monitor. And then it's also the follow-ups that are important. So if they can get someone else on board locally, the aim is resolution. So hopefully they'll get better and then we don't have to talk again.
Yeah, that's the idea.
Endearingly.
Yeah. Well, we'll make sure to put the website in the video description so people can
Thank you.
find you more easily. And a few people asked if you have any advice on trying to find someone with an approach similar to yours if they can't see you.
Yeah, I think it's important to reach out to people that have seen other practitioners. I mean, as a naturopathic doctor, I think I was trained just generally to look at all facets of an individual's life. There
Hmm.
are other clinicians that do that too, but I haven't trained in those professions, so I don't know what their general directions are. I think within this community, there are people who are broader in the way that they approach an individual, and I think that might resonate with people. So if you can do meet and greets, that's usually what I recommend.
Hmm.
Talk to somebody who's seen a practitioner. There's a lot of people out there that are doing some really amazing work, and really we learn from each other. So if there's other people that want to teach me something, I'm happy to. I'm always interested to learn what I don't know. You don't know what you don't know, but really that's how I would approach it is just to reach out and see who's out there close by. Also, one piece of advice is to find someone who is it's relatively easy. So somewhere if it's close to your house, it's not you're
Hmm.
not going to have to get up at 3 in the morning, or nourish yourself in a way that it feels like this is going to be a thing that brings wellness into my life. There's not one person or one silver bullet or one thing. Um, it's not going to be that one person or one place. It's going to be that part of the journey that I think is what's meant for you at that time. So there's a lot of really neat people out there. I'm interested to meet them too.
Yeah, we can also help connect people with clinicians if they reach out to our team. We do
Oh,
have
that's
a
great.
list of some similar clinicians around the world, and we're
Yeah.
always looking for more. So if any are watching this and would like to be connected with patients, clinicians are welcome to reach out to us too.
Oh, that's a great resource.
Yeah, well, this has been so helpful and I think answered a lot of the questions we received. So thank you so much again.
Thank you very much, Melissa. It's a pleasure.
Thanks so much for watching. I hope you found this expert video helpful. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for related articles. We'll drop some links in the video description. If you like what we're doing on this channel, you can support our work by hitting subscribe here on YouTube, and don't forget to tick the bell so you'll be notified of our future videos. Thanks again for watching, and until next time, keep asking questions and pushing for better solutions.